Hey everybody, it's Dr. Worsley here at Kountze Dental Center. On a Friday morning we're reviewing our cases that we've had from this previous week, and thought I would share with you one of the more interesting cases that we've had here recently. We had a patient that came in yesterday, had been to the ER and was given a shot of antibiotics and some pain pills and was referred to an oral surgeon to have his wisdom tooth surgically removed. He had heard about the VIP service that we offer here at Kountze Dental from one of his friends and was referred here. So what we did is we brought him into the office and got him comfortable, and we took a panoramic image of his teeth and his jawbones so we could see everything that was going on. And let's take a look together at what that looks like. So here's the panoramic image. Focusing on the right side of his jaw, you can see that he's got a few things going on here. He's got some root tips that are stuck in his gums on the lower right and on the upper right. But his problem was coming from this wisdom tooth that you can see is laid entirely sideways. And usually my experience is when a tooth is like this, that it has some curly roots to it. And I've kind of outlined on here exactly how those roots look. And the other thing that I've found a lot of times is that these roots have got some of this jaw nerve stuck around them too, and that's what causes the tooth to grow that way. And so the concern here is that if you pull this tooth out, you're going to pull some of that jaw nerve out as well, and you're going to have some numbness in your lip and maybe in some other areas of your mouth, and that could last for the rest of your life. So we don't want that to happen. So that's one of the risks of having this tooth removed. So I talked to him about another idea that I had would be to do what's called the coronectomy procedure, where we would take the top of the root off, or top of the tooth off, and remove the nerve from out of the tooth so that there wouldn't be any more pain, but we would not remove the tooth, and so we wouldn't have the problem with worrying about if we're going to damage the jaw nerve at all. So we talked to him about the risks and the benefits and the alternatives, and he felt good about doing the coronectomy procedure. So we got him comfortable with anesthesia so that he wouldn't feel anything but some pressure, and we removed the top of the tooth. Now let me click on the post-op image here so you can see what that looks like, and you can see we took the top of the tooth off, and then here's where the nerves were at, and what that'll do is that'll heal up now over the top, and one of two things will happen. Either bone will grow over the top here and he won't have any more problems with this tooth, it'll just kind of be sitting in his jaw, or else, like a sliver, these roots will work their way up to the surface, and then we'll be able to get them out rather easily. But I would suspect that there's some jaw nerve involvement here, and that's why this tooth formed the way it did, so we want to just leave that just like it is. Now he does have a small risk that he may need to end up going to the oral surgeon and having them remove these roots at some point in the future. But the risk of having some jaw nerve damage in my mind is far greater than the risk of him having to go through this procedure at some point in the future. I called him last night to see how he was doing. He said that he was having some soreness at the injection sites from the anesthesia, but he wasn't having any problems at all around the tooth area. In fact, he was very happy with the fact that he no longer had a toothache. And I'll follow up with him again in a couple of weeks to see how he's doing, but so far so good. So there's the coronectomy procedure.